871 in medic 6. You're seeing a 74-year-old male, shortness of breath.
Cold weather emergencies can sneak up without warning. While cold weather gives people a chance to hit the slopes, it brings unique emergencies for EMS, including hypothermia and the cold tissue injuries frostnip and, more severely, frostbite. It can also complicate patient assessment on medical and trauma scenes, where it's hard to tell if a patient's symptoms are due to the cold or other causes.
You're going to see changes in level of consciousness. Now, is the change in level of consciousness the result of the hypothermia, or is it the result of the medical emergency that you were called for? Well, the solution to that is relatively simple. If you warm them up and they're still not acting right, it's a result of the medical emergency. But if if they get better, great, because it was the hypothermia.
But before focusing on how the cold affects patients, it's critical to protect yourself and your team from the elements.
Whatever is occurring, you've got to make sure that you're keeping yourself warm, that you are aware of your personal environment. The first thing we teach every EMT is scene safety. And knowing the environment you're in is all part of scene safety. For example, let's take an automobile collision. I think the greatest challenge is maintaining your own personal warmth, especially if you're on the scene of a long extrication. It gets cold out there. As a responder on the scene, what has to take place is teamwork. I have to watch my partners have to watch me.
So what's the weather supposed to be like today, Brad?
It's supposed to be about 35, but it was pretty cold last night, so
Yeah.
got down to about 12 degrees.
12?
Yeah.
So full of fuel, got plenty of fuel today?
There needs to be a safety officer on the scene so that they're keeping an eye on everything that's going on. And it's the safety officer's responsibility to spot an individual who may be overexerting or may need some rehab. If you're working with a pair of rubber gloves, you're not working with your warm insulated gloves. So you have to be aware of the frostbite. You have to be aware of any exposed skin, depending on how cold it is. How much time you're spending outside. Are you in direct path of the wind, or are you shielded? Is there precipitation involved? Are you getting wet underneath your gear? If I'm taking care of a patient and I look up and my partner's teeth are chattering, maybe it's time for him to go sit in the back of the ambulance and we bring in another medic or another EMT.
Even with the best on-scene safety, there are precautions providers must take to help ensure their own safety. Dress for the event and weather. Be prepared for an extended deployment. You may be out in the elements far longer than you originally thought. Work in shifts if possible. Depending on the circumstances, have extra dry clothing, especially socks. While cold weather injuries are most common in obvious cold, they can happen anytime the body's temperature falls below 98.6 degrees. Cold injuries begin as the body loses heat faster than it can generate it. This heat loss happens in several ways. Vasodilation and sweating are helping to cool off the snowmobiler, and his wet clothing is conducting heat away from his body at a much greater rate than usual, since water conducts heat much faster than air. If he was in direct contact with metal parts of his snowmobile, that would increase his heat loss as well. The colder the environment, the faster people cool off, and the more surface area that's exposed to the cold, and the lighter the clothing, the more rapid the heat loss. With cold-related injuries, some people are at greater risk than others. Being out in cold temperatures is a factor, along with wind chill, being extremely young or elderly, having other injuries, suffering from a chronic illness, wearing improper clothing, being in contact with moisture or water, suffering from fatigue or dehydration, consuming alcohol, and being poisoned or suffering an overdose. With enough risk factors, patients can be affected by temperatures that fit healthy responders wouldn't think twice about. That makes it doubly important to be aware of the signs of cold weather injuries.
I think the primary concern is EMS awareness. Now, it doesn't really sound like a treatment, but all our treatments begin based on assessment. And if an EMT, regardless of their level of training, whether they're a first responder, EMT basic, EMT paramedic, if they go into an environment knowing the effects of a particular environment on a patient, they're going to be aware of the complications that could be involved. So if there's an incident that occurs and the EMT is aware of those implications, they can prepare themselves to, number one, look for the problems during their assessment, and while they're looking for the problems, once they find that particular problem, they could treat the problem.
Hypothermia happens when the core body temperature decreases to a point where normal muscle and brain functions are impaired. It can start with subtle symptoms and with time lead to death. Signs of mild hypothermia include shivering to generate heat, vasoconstriction in the extremities, and an inability to do complex physical activities.
Hey, help! There's a snowmobile accident down there a ways, and the man is very, very cold. He needs help right away.
Okay.
As the condition worsens, patients lose fine motor coordination, particularly in the hands. Shivering occurs, speech is slurred, and mental function is impaired. This may lead to irrational behavior like taking off clothing and being unaware of the cold. With severe hypothermia, the patient stops shivering and curls into the fetal position in an attempt to conserve heat. Muscle rigidity sets in, skin becomes pale, and pupils dilate. Pulse and respiration rates decrease, and the condition is life-threatening.
You have a patient going into shock. Now, what happens physiologically when a patient goes into shock? All the blood is starting to be shunted toward the core of the body to maintain the viability of the vital organs. It'll slow the pulse rate. It'll drop the blood pressure. It'll slow down the brain function. All in an effort to save the body.
As the patient nears death, breathing becomes erratic and very shallow. Consciousness fades. Cardiac dysrhythmias develop, and any sudden movement or shock can send the patient into ventricular fibrillation. Breathing and pulse can slow to the point where it can be very difficult to tell the difference between the living and dead.
Then it gets back to the old EMT training where they're not dead until they're warm and dead. And that ties into that mammalian diving reflex. The mammalian diving reflex is where the body is subjected to cold weather or cold water or immersion, submersion. What happens is all that warm blood starts being shunted toward the core to keep the vital organs alive. Well, in that particular case, hypothermia, the effects of hypothermia are not a bad thing.
You ready?
I'm set.
Follow standard assessment and treatment protocols based on the scenario you face, paying special attention to signs and symptoms that indicate hypothermia or cold tissue injuries.
If you've got a patient that is suffering mild hypothermia, there may be some changes in the level of consciousness. There may be some inappropriate answers to specific questions. If the EMT doesn't recognize those subtle changes, it can be disastrous. I mean, it doesn't have to be. It could be something as simple as a case of frostbite or frost nip on a patient, or it could be as serious as death, depending on the response to the changes that the patient is going to present to the EMT. Those are the consequences. You know, the EMT has to have excellent assessment skills.
What's going on?
My sled got buried. You guys want to help me with my sled?
Hold on a second. Let me check you out here for a second.
I'm fine.
Hypothermia isn't the only danger cold weather presents. At 28 degrees Fahrenheit or below, the fluid in body tissues can start to freeze, especially in the extremities. Superficial frostbite, or frost nip, involves the skin and can result in minor tissue loss. For frost nip, symptoms include skin turning white and waxy. The top layer will feel hard and rubbery, while deeper tissue is still soft. Affected areas will feel numb. Frostbite freezes deeper tissues and can affect muscle and even bone. With frostbite, the skin is white and wooden feeling all the way through deep layers. With frost nip, you can attempt to gently rewarm the area by blowing it with warm air or placing it against a warm body part, like the patient's stomach or armpit. Do not rub the area. This can damage the area by driving ice crystals through the fragile tissue. If frostbite is limited to small areas, it may be appropriate to rewarm it in the field, as with frost nip. Rewarming deep frostbite should not be attempted in the field. The need for these assessment skills goes beyond treating people who are out for some winter fun.
It's gotten to the point now where there are so many homeless people out there that they've adopted a particular name for it. You know, it's called urban hypothermia. It's somebody who is suffering the effects of cold weather because they have nowhere to go. And treating them can be a challenge because of the fact that many of the homeless patients that are out there now, I believe the latest national statistic was 30% of homeless victims are undiagnosed or diagnosed with mental conditions. Well, compound that with hypothermia, which has a direct impact on level of consciousness, you could see the challenge that's involved in trying to treat somebody like that.
If the patient is frostbitten and hypothermic, the first priority is increasing core body temperature. Do not rewarm frostbite until the core temperature approaches 96 degrees. Do not allow the patient to consume alcohol or tobacco, since both affect the patient's circulation in harmful ways. As always, follow your local treatment protocols.
Nice and easy steps, Bill. Slow. Go and lower the gurney for us.
In most cases, treatment comes down to the basics: conserving the patient's existing body heat and replacing what's been lost.
If you aggressively warm your patients, just a blanket, getting them away from the scene into the ambulance as quickly as you possibly can, making sure you don't leave any ambulance doors open so that all the heat in your ambulance is contained inside. It's not rocket science. It's being aware of environmental changes and being aware of the environment you're in. And remembering the fact that that patient is going to get better care when it's warmer. And it's going to make your job easier. It's going to improve the patient outcome. You can very easily continue treatment while a patient is covered. You know, you just roll the blanket down a little bit as you're working on a particular area, and then roll the blanket back and go to work on some other part of the body.
Treatment of mild to moderate hypothermia includes moving the patient to a warm environment like the ambulance or transport unit, removing wet clothing, using blankets to preserve body heat, applying hot packs to strategic areas like the underarms or groin, and using warmed, humidified oxygen to help heat the body from the inside out. Even with obvious cold-related injuries, be sure to check for trauma.
Bill, how you doing?
Cold.
Okay, get some oxygen on him, please.
With severe hypothermia, there are considerations beyond those being taken for this patient. For example, rewarming peripheral blood vessels in the arms and legs can send very cold, stagnant blood from the periphery to the core, further decreasing the body's core temperature. In addition, this blood is very acidic, which may lead to cardiac arrhythmias and death. When treating severe hypothermia, handle the patient with great care and only attempt to rewarm the body's core.
This one goes.
Use warmed IV fluids. Do not consider a patient to be dead from the cold until the body is fully warm. If the adult victim is unresponsive and not breathing, or not breathing normally, the responder may check for pulse, but begin CPR if a pulse is not detected within 10 seconds. Ventilate and provide CPR when indicated. Prepare to continue CPR for an extended period. Some hypothermia patients will revive after a considerable amount of downtime.
Okay, we're about ready.
Okay.
Think carefully about the temperature of everything that touches the patient, inside and out.
An ambulance sits in an ambulance bay with an ambient temperature of around 60 degrees, let's say. So what temperature is the solution, the IV solutions? 60 degrees Fahrenheit. You go start an IV on a hypothermic patient with 60 degree IV solutions, you are increasing their hypothermia. One of the old city tricks is to take a bag of IV solution or two, throw it on the dashboard, and every time your ambulance goes out, when that heater kicks on or the defroster kicks on, that's blowing warm air into them. So that could warm them up en route to a call.
Well, we've got you on oxygen. We're going to keep you on that for a while, but you are definitely improving.
Whether you treat cold weather emergencies rarely or routinely, your actions can have a tremendous impact on patient outcome.
Doctors and nurses in the emergency rooms like to see patients come in, warmed and viable. So if we do our job in the pre-hospital environment, it's going to pay off in great amounts later on down the road. It's not going to happen with every patient, but if it happens in 1 in 10, that's pretty good. Those are pretty good odds. If you could save one more, just save one. That's all we ask for.